All right, so IV bolus medication. So the first thing we need to do is we need to figure out, obviously you have an IV established. This can also be done intraosseously if you have an IO, so this skill can be done either or. It's just for the bolus of the medication is what we're looking at and the med math behind it. So we're going to give, let's say, 75 mics of fentanyl intravenously. So we're going to have to start with grabbing our fentanyl vial. We're going to make sure that we have good clarity in it and it's good, the expiration is okay. Go ahead and grab your needle and syringe, pop it on there, pop it back to 1.5. So we're going to give, if it's 100 mics in 2 mLs, that's 50 mics in 1 ml. So 75 is going to be 1.5 mLs. So you got to do a little med math. You got to write it down. That's fine. We'll go ahead and wipe the top of your vial after you pop the cap. Inject your air, and then draw up your 1.5 mLs. You're going to put your needle in a sharps container. Okay, we're going to zero this out and make sure that we don't have any bubbles in the syringe. Get it to 1.5, and then we need to do a MAC check. So we're going to hand this off to a partner, and we're going to literally hand them the vial and the syringe and say MAC check. We're going to go ahead and say we're going to give 75 mics of fentanyl for pain. What's your dose? My dose is 75 micrograms. What's your volume? My volume is 1.5. Any contraindications? No allergy. Blood pressure is good. Patient's alert and oriented. Go ahead and give it. Sounds good. Okay. Explain to our patient we're going to go ahead and give you something for pain through your IV. Go ahead and wipe the top of your cap right there with an alcohol swab. Screw it on and then push it slowly. And you verbalize that you're going to push this over 2 to 3 minutes. For time's sake, we're going to go a little bit faster. Get a flush. And then again, when you're flushing, that flush also has to be included in that 2 to 3 minutes as well, because there's still medication in the IV that you're pushing. So we're going to push that. Once you pushed it in, we're going to go ahead and clamp off. Dispose of your stuff in your sharps container. If you've got a narcotic, make sure you retain your vial in case you need to waste later. Go ahead and monitor your patient for desired effects, recheck your vital signs, and reassess your pain level if you gave fentanyl.